Chaplain, just want to say a word or two about cost. You know, we are probably saving each about $100 a month on Medicare and Medicare supplement from what we would be paying a private profit-seeking health insurance company. That comes to about, for the two of us, about $2,500 a year. And of course, we're not paying the co-pays. That would be several $100s a year, no doubt. On top of that, of course, I get Medicare prescription drug coverage, which, although not perfect by any means, saves me about 40% a year over what those drugs were costing me beforehand. So we are really quite pleased to be the beneficiaries of this program. I want to just ask you all to consider for a minute what life would be like for senior citizens in this country today if we didn't have Medicare and if we didn't have Social Security. I want you to imagine the poverty of life of many millions of senior citizens if there weren't for these programs, the misery, suffering, the hardship it would place on their families who are trying to support themselves and raise their children. So, yes, Medicare and Social Security are good programs, good government-administered programs, and we're glad they exist. But let me tell you something. These are not gifts that we receive from a generous government who happen to be moved to benevolence at certain periods of history. These programs exist as a fulfillment of the duty, the constitutional duty of our national government to promote the general welfare. You may recall from your school days that the preamble to the Constitution outlines the basic purposes of the national government: to ensure domestic tranquility, establish justice, provide the common defense, promote the general welfare, ensure the blessings of liberty to our generation and those that follow. Now, if our national government had adopted defense policies which didn't prevent foreign governments from annexing American territory and imposing their rule over what had been American citizens, we'd say that the government had failed to perform its fundamental constitutional duty. And we live in a time of ever-deepening healthcare crisis, driven primarily by the profit-seeking of private-owned insurance companies, and it's high time for the government to step in and act on our behalf to protect the public interest, promote the general welfare by curtailing the profit-seeking behavior of these private companies. They may have a place to play, a role to play. I say they may have, not necessarily so. You know, for a health care system, you need patients, doctors, nurses, clinics, hospitals, medicine, and some way of paying for it all. Nowhere is it written in stone that the method of payment has to be done through the hands of privately owned, profit-seeking insurance companies. There are countries we know quite well that get along without these companies. So it's time for our government to step in and act on our behalf, and it's time for us to let our voices be heard. Call Tom Perriello, Jim Webb, Mark Warner. Let them know that you want them to do everything in their power to have a strong public option in the pending health care legislation so that the government will fulfill its constitutional responsibility to protect the public interest in this regard. Thank you.
Thank you.